fascia doing the extensors of the toes. That's front line. It goes up following the sternum and then bifurcates with the SCM tendon to the mastoid process. The back line, when we look at it, is going to take the front of the head and go around the back. It's two back lines really, right and left, as they go down the spine. They bifurcate at the thoracolumbar fascia, pick up each sacrotuberous ligament, the ischial tuberosities, the hamstring tendons, drops the hamstrings, hits the femoral condyles, comes down the calf, and picks up all the plantar fascia. So let's say for a second, if you've got a plantar fasciitis condition and you don't work the front and back line, you won't resolve that condition as well. That, in an indirect saying, is maybe the neck could be affecting the plantar fascia, but most of the time that's not the case, but it could be some of the time. Let's check now some passive range of movement. When I roll the leg, femorally and tibially roll out and in, she goes so far, and then now fascia is at the first level of restriction. Fascia is at the first level of restriction. Muscle and joint are at end field, tendon, but fascia is first level. That's the superficial fascia getting in the way. She's trying to anticipate me too. Now she's got pretty good rolling movement, but she's helping me a bit. That's where it stops. That's where it stops. That side, not so good. Can you see that? What you'll have to do is feel that. You'll have to see and feel. I know you can see it. I'm going to have to get you to feel it, because you were already looking at me like, what? Okay. Well, okay, so just doing that palpation, what was hard about it? What was difficult? Feeling it. This is what I got to do with every one of you. This is going to take some time. You're going to have to be patient with me and yourself. If you do that, we're going to speed. But if you can't do this, you're not going to like the course, because if you can't do that, it's not going to make the other things go as well. However, that said, even if you don't feel it, we can still get the results if we reassess. So some of you won't feel it. That's okay. You'll still get results, but you're going to have to assess and reassess. Assess so not to guess. Okay. Now that's the movement. Let's check passive dorsiflexion and plantar flexion at the end. No. Stop. Breathe. Somebody put a hand over her eyes. Yeah, so she can't see or hear me. That's what she can do. And that's lovely. She's very fit on a lot of levels. Goes up but doesn't go into plantar flexion. Now we get more if we pillot her, but I want the lines sort of intact. The last assessment on the line is going to be this one. Relax. See, this is nervous system, isn't it? See, all of this saying relax is nervous system. You're dealing with the nervous system, anticipating everything I'm doing. So you're trying to assess tissue, and you also have to understand that you've got to navigate this nervous system to assess the tissue. Okay, now we're going to take her up into flexion. Let it go. Let your head go. Let your head go. Into flexion, there's end field. Let it go, let it go, let it go, let it go, and let it go. And there's extension. Cranial base is tight. Posterior cervicals are tight. Well, that was fun. Let's try the next motion pattern. Oh, at least she's letting me do that, because I sort of gave her a talking to. That's beautiful, by the way. And now, here's the stroking technique that you guys know for gliding. Okay. Now this is, ooh, click, click. Does that do that all the time?
No.
Oh, what do you know? Okay. Is your head